Hi, I'm Jeff Cohen from the healthcare law firm in Florida, in Delray Beach. I wanted to talk with you about HIT regs, the meaningful use regulations. You may be familiar with them. You know that there's a phase-in of information technology into medical practices as a result of the healthcare reform law. Essentially, the HIT regs and EMRs, electronic medical records, are a necessary element, if you will, the thread that will weave together and help accomplish the two primary objectives of healthcare reform, which is demonstrate and reduce cost and demonstrate and improve clinical outcomes, quality. HIT, health information technology, is now a necessary part of medical practice and healthcare. It's not only something that's a necessary part, but physicians need to be aware that there's two primary issues that they're faced with immediately. One is when they begin to implement EMR, electronic medical records, into their practice, they become eligible for money from the government, roughly $44,000 per physician if you're taking Medicare. And if 30% of what you do is Medicaid, and another $20,000 or so on top of that. So physicians have an economic incentive to comply with these regulations and to implement the necessary information technology into their practice. What we were waiting on over the summer, and which arrived in July, is what's called the meaningful use regulations. Those are the regulations which essentially impose upon the information technology the certain things that the information technology has to do. And there are certifying bodies for the information technology. So now physicians can purchase or engage in the use of certified information technology, which, as of July, meets the meaningful use criteria. Very important that you have both in place. So what are some of those things that you'll be looking at if you're looking to implement information technology in your practice? I'm going to read because some of them are very specific and I honestly don't remember them. But, for example, there's, according to the new regs, eligible providers, including physicians, are subject to 25 specific criteria. Hospitals have 23. The final rule sets forth the standard formats for clinical summaries and prescriptions. It defines terms to describe clinical problems, procedures, and lab tests, and other things like that. In general, the final rule is designed to give professionals and hospitals greater flexibility in demonstrating meaningful use of certified EHR technology, electronic health record technology. The flexibility arises out of the rule's three-step process. The final rule establishes stage 1. A stage 2 is an update, which is scheduled for the end of 2011. And a stage 3 update is scheduled for the end of 2013. At this time, physicians have to meet a core group of 15 required objectives, including, I'll just read a few of them because there's too many to describe, and they're available on the CMS website, the Center for Medicaid Services. Number 1, use of computerized provider entry for at least 30% of all unique patients with at least one medication in their medication list. 2, implementation of drug and drug allergy interaction checks. 3, recording and charting changes in vitals like blood pressure, body mass index for at least 50% of all unique patients between ages 2 and 20. Recording smoking status on at least 50% of patients over 13. And there are others. The bottom line is, these are some of the new meaningful use criteria that's part of the stage 1 phase-in, which if the EMR accomplishes that, the electronic medical record, or EHR, electronic healthcare record, if it accomplishes that and you do those things, then you're complying with the meaningful use regs. Meaningful use compliance is something that's going to change over time as the phases 2 and phases 3 become implemented over time. So you'll have to keep a close watch on that regulatory development. Thanks very much.